Well, we always love visiting with Dr. Todd Bell. It seems like you're just right in the middle of everything, and you see so much. Have a new baby. My sister has a new 8-week baby. He has a cold right now, but everybody's saying RSV. What is that, and why are they saying it's everywhere, and how does that happen? How's it work?
Right now I do feel like I'm in the middle of things. I'm on the wards this week in the hospital,
Sure.
and so we have lots and lots of RSV. RSV is a type of virus. It comes around every year. The timing of it changes a little bit, but it's sometime during the winter time. It's a type of virus that everybody is going to get exposed to in their first 1 to 2 years of life.
Okay.
But it really seems to cause problems in babies. So especially kids between the ages of maybe 2, really 4 months and about 6 months. That seems to be that time period that kids are at the greatest risk of having trouble.
Okay.
Babies younger than that, babies older than that can get RSV and can sometimes have problems too. But boy, for those 4, 5, 6-month-olds, it's really an issue.
Okay.
Part of the reason is that as children get a little bit older, a newborn doesn't have a very active immune system. As they get a little bit older, they have more of an immune response to things that are around them. That's generally a good thing. Except that RSV, as it gets down into the lungs, as it gets into the nasal passages, and you get that immune response, you get lots and lots of sort of mucus and phlegm. Sure. And it kind of clogs up, if you will, those airways. And in those babies, their airways aren't big enough to be able to allow air to pass, go by those mucus plugs and phlegm and things like that. Right. So those are the kids that end up in the hospital. The good news is usually RSV goes away. It does always go away. Sure. Usually it's able to go away and we don't end up in the ICU, things like that. The bad news is we don't have anything that makes it go away faster. Breathing treatments, things like that, they don't help with RSV. And so we end up with some kids that come in and it's a matter of just sitting and waiting and giving time in the hospital sometimes with oxygen even to be able to let kids get past that. So if folks have kiddos who aren't sick and they're in that 9 months and younger age, lots of hand washing, trying to avoid other children who may be ill. That's important. Yeah. And then if a child does get sick, and especially if they seem to have trouble breathing, lots and lots of cough, difficulty eating or not eating well, not making as many wet diapers, they need to go see their doctor and let their doctor check the baby out.
So smart. Always love it whenever you come. Where can we find you? Where are you at, and what are you doing, Doc?
So I'm actually the chairman of the Department of Pediatrics at Texas Tech. And this week you would find me on the wards at Northwest Hospital because that's where I'm spending about 12 hours a day.
Hang in there. Thanks for coming. We appreciate you so much.